Hello judges and anyone else who's watching this presentation. My name is Nico Basifsi. I'm a grade 7 student at St. Bernadette Catholic Elementary School. My project is called Head in a Swim. Head and neck injuries are some of the leading causes of disability and death. Specific injuries such as skull fractures, concussion, whiplash, and hemorrhages can occur in contact sports. Sports such as hockey can produce life-changing brain injuries. Hockey is a fast-moving, aggressive game that is played on a sheet of ice surrounded by boards and glass. Head injuries occur in hockey at every age and skill level. In top competitive levels, up to 25% of players are concussed each season. Furthermore, these injuries do not just happen to professional athletes. Brain injuries can happen to anyone, especially children and adolescents. Research proves that children and adolescents are the most vulnerable and take the longest time to recover from these type of injuries. Devices such as helmets are critical in reducing the severity of brain injuries. However, they are not proven to reduce snapping rotary force and acceleration that can cause other brain injuries such as whiplash and concussions. The leading cause of these injuries is due to brain acceleration. However, there is no injury threshold or clarity about how you can reduce these risk factors. Therefore, I wanted to investigate how helmets can reduce the severity of head and neck injuries resulting from hits involving glancing blows to the head. The purpose of this project is to design an experiment simulating the type of hits similar to those resulting in head or neck injuries and investigating the role that helmets play. This experiment aims to investigate linear acceleration, rotational acceleration, and whiplash-like impacts. I chose this project because 3 of my hockey teammates sustained concussions during the 2019-20 OMHA season. I wanted to find a way to help reduce the risk and severity of suffering from one of these injuries. My hypothesis was that helmets will reduce blunt force trauma from a pendular impact to the head, but helmets will not reduce the rotational motion from one of these glancing blows. To test my hypothesis, I followed this procedure. The full method is in my report. This is just a summary. First, I will build a crash test dummy using a styrofoam mannequin head that is attached to a foam roller by a metal rod. Then I would build a pendulum swing consisting of a 3-pound dumbbell that is tied to a string that is attached to a ceiling hook. Lastly, I would conduct my experiment. I performed 2 tests twice, once using a helmet and 1 test without using a helmet. The first test would see any indentations simulating a skull fracture or brain bruise. I would also investigate the distance the head rotated after colliding with the swing, resembling a concussion or whiplash-like effect. To perform each test, I would drop the pendulum swing from a starting point 0.5 meters above the table. I would then move the swing to a 45-degree angle from the starting point. Then I would drop the weight at a speed of 4 kilometers an hour. I will then investigate the velocity of the weight after it hits the dummy, seeing if it increased or decreased speed, and use a goniometer to investigate the degree of rotation. I conducted my results on February 21st, 2021. These are the results, and I will give you a summary. The rotation of the head without using a helmet varied in degrees from 80 to 101. When using a helmet, the rotation was still higher than one that could reduce the risk of concussions or whiplash, varying from 25 degrees to 49 degrees. When testing the indentations, I used an evaluation method where NA meant there was no indentation, small meant that the indentation was less than 5 millimeters in depth, moderate indentations were around 5 millimeters, large indentations were anything over 5 millimeters in depth. Without a helmet, indentations varied from small to large, the most common being a large indentation. When using a helmet, the results were the opposite. The most common indentation was NA, or no indentation, and helmets eliminated any large indentations. Lastly, the change in speed after the weight collided with the head. To decrease the risk of concussion, the speed must decrease by at least 25%. Without using a helmet, the mean speed change was an increase of 7.5%. When using a helmet, the mean speed decreased by 7.5%. After completing my results, I learned that my hypothesis was correct. The results show that helmets do reduce the severity of direct, blunt impacts to the brain or skull, but do not reduce these rotational forces. Some explanations for this are that helmets do not support the neck or torso. Also, the point of contact caused the head to rotate sideways. The cheek area simulates glancing blows to the head and makes the head snap back or rotate, causing more rotation. Helmets support the neck and skull and do a great job at reducing head blunt force trauma from hits to the head. They do an excellent job at reducing the severity of injury and preventing long-term effects from structural head injuries. Some explanations for this are that helmets are designed to disperse and absorb force from hard hits to the head. Also, this experiment simulated glancing blows to the head, usually the ones that result in more concussions rather than head injuries such as skull fractures. The awareness of concussions and research on them and whiplash continue to grow. However, this experiment shows that concussion and whiplash research is very complicated. There are many risk factors, symptoms, and every injury is quite unique. When researching concussions and whiplash, it seems that there is not a standard type of injury. There are 65 different symptoms of concussion and whiplash. It is hard to recreate a real concussion because there is no perfect cause and effect scenario. They are caused by many different situations and collisions and can result in many different symptoms. This experiment was designed to see if helmets help decrease concussion risk factors from glancing blows to the head. It was not designed to decrease concussions from other type of impacts. If I did this project again, I would compare different helmets. I'd also try to test linear acceleration and experiment with different points of contact. I would also try to build a prototype that could potentially reduce the risk of concussion. This experiment shows how big a role helmets play in stopping direct, blunt impacts and keeping the head safe. Despite this, helmets still do not effectively reduce rotational forces to the deeper structures within the brain and do not decrease the risk of whiplash or neck injuries. Even though helmets have little effect at reducing whiplash or concussion, this experiment proves how important helmets are at reducing serious head injuries. This experiment shows that it is crucial to wear helmets during contact sports and that further research is needed to reduce the risk of concussions and whiplash. Thank you for your time.